Hello everyone, we will look at a common psychiatric disorder today, called depression. What is depression? Depression is a common mental health disorder that presents with a depressed mood, evidenced by a loss of interest or pleasure, feeling of guilt, or low self-worth, disturbed sleep, disturbed appetite, low energy, and poor concentration. These symptoms can be remembered in an acronym called SIGI-CAPS. S for sleep changes, either an increased or decreased sleep. I for interest, loss of interest. G for guilt, feeling of guilt. E for energy deficit, that is a low energy, or easily getting tired. C for loss of concentration. A for increased or decreased appetite. P for psychomotor changes, which includes agitation, slow physical and emotional reactions. And S for suicidal thoughts. You may wonder, what really causes depression? Or what are the risk factors? Well, adverse life events, especially the loss of a loved one, or the loss of a job, lack of parental care, postpartum, that is after delivery of a baby, childhood sexual abuse, and even adulthood are all risk factors for depression, especially if the individual experiencing such an adverse event is not treated by way of encouraging them and administering medications to help them live a normal life. Other risk factors include a family history. Research studies cited in the Oxford Handbook of Psychiatry, on page 242, suggests a mean of about 37% chance of depression occurring in individuals who have a family member who have experienced a depression. Diseases are also a risk factor for depression, and they include stroke, diabetes, post-myocardial infarction, all cancers, epilepsy, also drug abuse, and alcohol abuse are potential risk factors for depression. So, how can we approach depression? The most important approach is seeking for help from your doctor, usually a trained psychiatrist. In the world today, there are a lot of sad events, but do not give up. If you experience any adverse event, don't carry the burden all alone. You can trust a psychiatrist if you don't feel okay sharing with your associates. Sharing the burden helps reduce the effect of depression. Talk to a doctor. Don't hold it all by yourself. This also applies to any existing health condition you may have. Don't abuse drugs, nor alcohol. This is a modifiable risk factor. In summary, depression is often undiagnosed and untreated. Please seek for help. Remember SIGI-CAPS. For the symptoms of depression, there are various ways to help treat depression, with and without drugs. Have a wonderful evening.